Hi, my name is Terry Klemm. I am a third-year family medicine resident. Just getting ready to finish here at St. Joe's at Creighton Family Medicine Residency. I am actually a Phoenix resident. I grew up in Phoenix. I've lived here all my life, went to high school here. I did go out of state for college to California at Loyola Marymount University. But I trained and went to medical school at Midwestern University in Glendale, Arizona. And so trained there for 4 years before I applied to residency. And all of my family lives in Phoenix. So I wanted to stay here and try and, do my residency here as well. And I was able to match at my first choice, which was here at St. Joe's at the Creighton program. In my decision to become a doctor, I've always been somebody that loves kind of interacting with people, kind of hearing their stories, learning, kind of what their backgrounds are. And so I've always just been, really enjoyed conversations with people and learning about, things that make people tick. And I think in school, really loved science as well. I just was a biology major and loved, people, plants, animals, all of the above. So kind of combining the two was where I was able to fit kind of my career in discovering medicine and trying to go the path of going through medical school. And those kind of fit the best for me, and as far as finding that career that I was going to pursue long term. I chose family medicine mostly because there was nothing in medical school that I did not like. I really enjoyed all of my rotations and loved really seeing patients of all ages. I think that I was able to connect with, little kiddos and then all the way up to elderly patients as well. And it was kind of fun to see kind of the progression of patients coming in of all different ages. And I liked the variability of that in family medicine. And now it's really fun for me to see families as they grow. So, seeing the babies come in and see them for their well child checks, but then also seeing their mom or their dad in clinic too is really fun. So I definitely have lots of families that come in that I'm able to see multiple members of their family, which is pretty fun because you kind of get to interact with them more than one occasion and get to follow up with them throughout their lifespan and really just kind of get to work through, any issues that they may be having and trying to provide them the best care that you can. I have really enjoyed my residency at Valleywise, mostly because I feel like we get a very well-rounded learning experience. We're able to work with a lot of specialists. I think family medicine rotates through multiple different specialties to kind of learn the ins and outs of that specialty and how, best to treat our patients and how to organize their care. And so I think that Valleywise has really provided some of really, really amazing specialists that have been kind of top of the line in their field so that, when you're training, you can ask them any questions or you can always, refer to them or text them, even if you had questions about your patients that you're seeing in clinic. And so I felt like it's been a really nice residency as far as size too. It's big enough so that it's a big medical center, but also provides lots of different resources for residents to train. With the Creighton Alliance, the two hospitals have merged so that you can do rotations at both St. Joseph's Hospital and the Valleywise Hospital. And that's been kind of newer for me throughout my experience as a resident. We've been incorporating more of our rotations at the Valleywise site and trying to kind of incorporate, I think, a little bit more from that site compared to when I first started. But it's actually been pretty cool. I think, now we also have combined residents. I mean, like they used to be more separate, but now there's a larger group of residents that have come together. And so, you're definitely working with lots of different fields of residents that are coming through, whether it be OB or surgery or any of the specialties. But I think it's definitely been nice to have a couple of different locations because, first of all, each hospital system is a little bit different. And so it's kind of nice to see, okay, here's how it works here, but this is another way of doing things. And you kind of get to experience a little bit different style at each site. Each hospital, I think, really does have great attendings at each one. And so you're able to learn from different attendings and their different styles too. So there's definitely a lot of variability. And so by expanding it and kind of the new combination or the alliance partners have really, really opened up even more rotations for us in the future. My experiences learning from mostly our family medicine faculty has been pretty excellent. I think they have challenged me to really think about our population base and who we're seeing and how to best create the treatment plan for that specific person. We definitely have like a more underserved population base in downtown Phoenix. And so that sometimes like brings certain struggles with how you are treating and how you're figuring out, the best way to organize their care. I think that's definitely something that our faculty tries to really hone in on is what can you do to make this person's life easier? What can you do to really make a difference for them in making their care actually attainable and actually meeting their goals? Because that's really important. Like specifically, if you're prescribing medications, you would want to make sure that you're picking not only ones that are going to be good for their medical condition, but that they can afford and they can be on long term and is really going to fit into their lifestyle. And then also thinking about, maybe services that they could benefit from as far as whether they need diabetes education or nutrition education or providing those behavioral health resources for them, I think is what our faculty definitely really tries to focus on that and challenges us to really think about that when we're creating those care plans. While training through a pandemic, certainly it's been a very, crazy learning experience. I think the one thing that I've taken away from it, though, has definitely been the fact that you have to be flexible in medicine in general, but then this really caused us to kind of embrace change and at a very quick pace. I think we kind of had to take this on as a whole medical field, and it was very scary at the beginning, and training in a big hospital. There was just a lot of unknowns and the spread of COVID. And I think it wasn't until later on that we could kind of give better advice for our patients and everything. And so, yeah, it was certainly scary at first, but I think that, the takeaway from it was that being flexible and there were so many changes even within our clinic and trying to incorporate a lot of telemedicine visits as something that we offered to our patients. And that was totally new. We never had anything like that in the past. And I think that's probably something that is going to be a change to medicine in general. I think that's not going away. I think that it's provided a lot of ease of access of care for patients, and they've really been able to use that for, maybe more simple appointments that don't make them travel across town or, if they're in the middle of a work day or something like that. I think that's given them the opportunity to make those appointments a little bit more ease of access. So definitely, I think that was something that changed medicine for sure, was incorporating those telehealth visits. And I think that's certainly something that's going to stick around for sure. I think as far as what I would wish for as far as support for the remaining years of my residency, I would say, some of the main things that maybe we've lost out on a little bit with COVID is definitely some more hands-on training, for example, like that are just more workshop based. I would say for us, we kind of lost out on that over the past year. So, whether it be suturing workshops or different procedure workshops. Those, have been harder to do because we can't always meet in person. But I think now, as things are kind of calming down a little bit, that would be something, whether, they are simulation training or where we meet in a conference room and are able to practice these skills. I think those are certainly things that I would love to see in the rest of my training as a resident. The other thing I think is really important is, overall mental health and wellness of residents. I think our program is really trying to work towards creating this atmosphere of residents that are able to go to each other and have that kind of family atmosphere. And so in order to do those things, we love to get together on outside of work and trying to create those friendships and those bonds. But those are really important aspects of going through residency and really surviving is having a strong wellness base and being able to kind of get through each work day. And so, yeah, just support as far as making sure that residents are taken well care of, as they're getting their food in their cafeteria, they're happy people, and they're getting along and really enjoying the job that they do. After residency, I actually just got a job at a federally qualified health clinic that is here in Phoenix. So I'm glad to be able to stay in town and continue working here in Arizona, but it's through NOAA Clinic under the Honor Health system. And so I'm really excited to really work in an outpatient setting and continue to provide those resources for a very similar population base. And so I've really enjoyed my training in that aspect because I think that it'll really set me up pretty well for my future in working in outpatient family medicine. I would just thank all the donors that have provided the technology and learning opportunities that have really made my residency experience and the training of the future doctors and providers. It's really made my experience that much better. And I'm just really excited to kind of go out in the world and be the best provider that I can be because of the training that I've gotten. And, it's really, I think, been beneficial for healthcare in general, but then just the Phoenix population. I think we've definitely been able to make a difference and providing lots of residents that are going to be future doctors of America. So it's pretty cool. Through training at St. Joe's and through Valleywise, definitely our population is more of an underserved population. Definitely has increased needs. So learning how to navigate that type of population was something that I had to really hone in my skills throughout residency and figuring out the best way to actually organize that care. And I think that through this residency program, and the different resources that we're able to provide, I think that is going to help me in the future when I do go to a federally qualified health center. I definitely think that it has made me, more confident in that way. And I think that it makes me want to continue to serve this population because I know that they really do appreciate it and they really are just looking for that person to kind of lean on and to be their kind of guidance. I think that this residency has definitely influenced my decision to continue to work with a similar population base in the future.